My name is Dr. Jeffrey Jacob. I'm a neurosurgeon with the Michigan Head and Spine Institute, specializing in complex intracranial neurosurgery, skull-based surgery, and endoscopic neurosurgery. My wife and children and I are very happy and excited to come to the state of Michigan, and I'm very fortunate to work with the Michigan Head and Spine Institute with world-class physicians and specialists, and I'm very excited to bring the level of expertise and passion from my practice at Mayo Clinic here to the state of Michigan. I went to medical school at the Mayo Clinic in Rochester, Minnesota, where I also completed my residency training and advanced fellowship in skull-based and endoscopic neurosurgery. Skull-based surgery involves using specialized techniques to get to deep locations of the brain, at the base of the brain, brainstem, and surrounding cranial nerves in the most delicate and safest possible way. Given the types of conditions that I treat, I also have expertise in gamma knife radiosurgery, which is a very accurate way to deliver focused radiation for a variety of conditions that involve the brain and cranial nerves. Although the majority of my practice involves skull-based surgery and complex intracranial surgery, I'm also a general neurosurgeon by training and therefore have expertise in spine surgery, be that minimally invasive spine surgery or other spinal stabilization procedures, depending on what the patient needs. One of the conditions that I have a lot of passion for and have a lot of expertise in is a condition called acoustic neuroma, which is a benign tumor affecting the hearing and balance nerves. And with regard to acoustic neuroma and other disorders affecting the cranial nerves and hearing, we certainly have one of the largest experiences with that in the country, and I have the great fortune of working with world-class neuro-otologists at the Michigan Ear Institute to provide the best possible multidisciplinary approach to managing these patients, whether it be through microsurgery, observation, or stereotactic radiosurgery with the gamma knife. And we work with each individual patient to decide what is the best possible approach for each of them. In addition to skull-based surgery and disorders affecting hearing, another condition that I manage very often are cranial nerve pain syndromes. A very common one is trigeminal neuralgia, which is an electric shock-like pain syndrome, which is very debilitating to patients. And we're very fortunate to have a multidisciplinary team involving radiation oncologists, myself in neurosurgery, and a variety of other specialists to offer the most effective treatment to manage these patients. We are very fortunate here, particularly due to the work done by my predecessor and dear colleague, Dr. Daniel Piper, to have a world-class multidisciplinary team involving radiation oncologists, ophthalmologists, plastic surgeons, and ENT physicians, among others, to offer the best, most individualized care to patients with complex intracranial conditions. If you have a neurosurgical or skull-based or complex spinal condition for which you would like to speak to a neurosurgeon, I would love the opportunity to visit with you here at the Michigan Head and Spine Institute.